Hello, ladies and gentlemen. Welcome to our exploration of data-driven strategies that are revolutionizing the field of medical affairs. Referring to our latest tutorial about data-driven strategies, today we'll uncover 10 key learnings that can transform how medical affairs teams operate, enhance their impact, and drive better outcomes for patients and stakeholders. First, let's talk about data integration. In today's complex healthcare landscape, bringing together data from various sources, clinical studies, real-world evidence, and market insights, creates a holistic view of patient needs and market dynamics. This integrated approach allows us to make more informed and strategic decisions. Next, we have predictive analytics. By leveraging statistical models and machine learning, we can forecast trends, identify potential risks, and guide proactive decision-making. This approach moves teams from reactive to predictive, improving the effectiveness of their strategies. Stakeholder mapping is crucial for understanding who influences the success of your medical strategies. By analyzing data, you can identify key opinion leaders, influencers, and other stakeholders, allowing for more targeted and impactful engagements. 4. Evidence generation. Evidence generation involves using data to identify gaps and prioritize research that aligns with both market needs and strategic goals. By focusing on the right evidence, we can better support clinical decisions and also product positioning. 5. Performance metrics. Performance metrics are essential for evaluating the success of medical affairs activities. Setting and tracking key performance indicators, or KPIs, helps teams assess their effectiveness and adjust strategies based on data-driven insights. 6. Personalized engagement. Data enables personalized engagement with healthcare professionals. By understanding preferences and needs, we can tailor our communication strategies, making interactions more relevant and valuable. 7. Competitive intelligence. Competitive intelligence is about analyzing data to understand what your competitors are doing. This insight allows us to anticipate market movements, respond proactively, and find opportunities for differentiation. 8. Patient insights. Patient insights are critical for patient-centric strategies. Data analytics helps us in medical affairs understand patient behaviors, treatment adherence, and outcomes, which can be used to inform more effective and personalized approaches. 9. Measures the impact of medical affairs activities. By assessing which initiatives deliver the best results, we can ensure that resources are used efficiently and effectively. Finally, regulatory alignment leverages data to ensure compliance with evolving regulations. This alignment supports evidence submissions and keeps medical affairs in sync with global regulatory standards, reducing risks and enhancing credibility. So, these 10 learnings illustrate the power of data-driven strategies in medical affairs. By integrating data into every aspect of our operations, we can make more informed decisions, engage stakeholders more effectively, and ultimately drive better outcomes for patients and the healthcare community. Thank you very much and see you in the next tutorial.